Hey people, my name is John, and in this video I'm going to go over my experience of getting plastic surgery consultation with Dr. Charles Lee. Okay, so I got the consultation yesterday, which is November 28th. I'm making this video on November 29th. My surgery date is actually tomorrow, November 30th, like very early in the morning. So I thought I'd take a moment to capture my experience getting the consultation with Dr. Charles Lee. So I want to go over 3 points. I wrote down some notes. 3 points I think are very important. First one, which is, my impression of the guy and how he runs his company. The second one, which is, the details of how the consultation went. And the third one, which is, what procedures he recommended, and of course the price. Okay, that's a very, very important point. Okay, so let's go over the first one, which is my impression of the guy. So when I walked into the office, one of the things that you'll immediately notice is that it's very nicely decorated, and the staffs are all female and pretty attractive. Furthermore, a lot of them looked like they were operated on, and indeed later I confirmed that was the case. So immediately you get the sense that it reminded me very strongly of the time I went to South Korea. Everything looked very nice superficially, and everything pertained to a very narrow set of superficial standards. So basically he's very well aware of the superficial standards, and he's very aware of his image. So he's probably like a grandmaster at marketing. So that's one of the things that I think is immediately self-evident. However, digging, around online, of course, any doctors are going to have, a butcher jobs, complications, if you will, or undesirable results. But I think overall, the guy's been in the industry for 20 years, right? And if you're a surgeon and you've been butchering people left and right for 20 years, you're probably not going to be around that long. So I reason that because he charges a slight price premium compared to other plastic surgeons that operate on Asian face, and because he's been around for so long, of course, no surgeon can completely cut off all undesirable results. If that was the case, then they would just be able to charge monopoly prices on these surgeries, because then they can guarantee a favorable result. So no surgeon can do that. But I think to the extent of what can be reasonably accomplished by a skilled surgeon, I think I'm saying I think he's capable of adequate results from digging around online. So basically, to summarize point number one, my impression is that he's really good at marketing. He probably charges for sure at an above average market price. I've been calling around, his stuffs are definitely a little bit more on the expensive side, but I feel despite the price premium that perhaps he is capable of adequately getting good results, getting satisfactory results. So the second point I wanted to mention, which is how the consultation went. So I'm reading some of the negative reviews. I was actually expecting the consultation just to be in and out really quickly. I was a little bit nervous. I thought maybe he would be kind of pushy, but in fact the consultation went really long, and we went off on tangents that lasted sometimes a good 2 minutes or 5 minutes. So he seemed really patient, but maybe that's because I'm making a large purchase. I'm doing my eyes, nose, and chin. Which is what my superficial friends recommended. So prior to going into the consultation, I took it upon myself to go out and meet people who are exceptionally superficial. So people who are, into Kpop, or people who have gotten surgeries done themselves. Normally, I'm not a very superficial person, but I thought I wanted to get their opinion on what is, objectively suboptimal on my face. And my friends recommended that, I need to get my nose and chin done, and then my eyes are okay. And that was sort of, what Dr. Charles Lee recommended as well. But as it turns out, I'm actually wearing double eyelid tapes. So for my eyes, I wanted to get the non-incisional method and essentially achieve similar looks, but without wearing a tape. So if it was a case that I had these eyes naturally, then I think the rational thing to conclude is that my chin and my nose can use a little bit of work, and that's what my superficial friends and Charles Lee both came to that same conclusion. So that was the second point. So the consultation seemed really long and detailed, and he seemed fairly honest and not that pushy. So the third point, which is price. So I'm getting a double suture method done on my eyes, my chin, which I'm getting an implant to basically protrude this on the side about 1 centimeter, and then I'm getting a nose that looks a little bit more Caucasian, so a little bit higher ridge, and the tip a little bit more refined. And so these are just rough estimates. The eyes are around 5K, the nose is around 15, and the chin is around another, I think 5 or something like that, or 7. But they all even out to be about 25,000. And I'm getting a slight discount because I made it okay to release my photos on his website. Apparently, like, that has some kind of marketing value to him. Hey, I'm not complaining, you know, it's an expensive surgery. But I think in the light of like what other assets you can acquire for $25,000, you know, like maybe like a new car, like a new Prius, or I don't know, like maybe a couple of vacations. I think for sure like the surgery is expensive, but when you measure it against other sort of luxury goods, other, you know, sort of pure consumptions, I think that the surgery starts to make a little bit more sense when you start measuring it against, you know, getting a new car versus an older car, you know, going on a you know, cruise versus maybe just going to Vegas, and then you measure that against the value of, you know, just being more confident and having a more objectively more appealing face. So I think in the light of that, the price of 22, 25,000, something in the neighborhood of that, depending on how steep of a discount you get, I think that starts to make a little bit more sense. So yeah, so that's my first video. You know, this is how a consultation went. I'm gonna make a little bit more videos following my you know, procedure, the healing, which is what I really wanted to, you know, document, because if everything works great, then, you know, there's really nothing to talk about, right? You go in, you suffer for a few weeks, you walk out permanently more attractive. But I think what will make this channel valuable is to really talk about some of the finer points that maybe get glossed over, you know, the healing process, you know, the pain, maybe potential small complications that, you know, come up, and how they're resolved either with makeup or more revision. I think those are going to be the more interesting points to talk about. So yeah, definitely stick around if you're interested in this topic. Thanks for watching.